Hello, assalamu alaikum. Good evening. So today I want to discuss about MRCPCH actually because MRCPCH is very important exam. So let us see how it is. Just yeah, just a minute. It's also live in Facebook and other. So MRCPCH exam is the Royal College exam of pediatrics and child. It's UK-based exam, and it is very important exam for the UK for their career progression. As well as you will be happy to know that this exam is totally important and career progressing exam in the Middle East, Malaysia, and Singapore. Every year, a lot of students appeared in the MRCPCH exam, and it is actually 3 parts exam. Okay, so member of the Royal College of Pediatrics and Child Health, which exam is only the accepted way of postgraduate exam in the UK. So it is one of the postgraduate exam. Although these exams ensure the entry of the pediatric training in the UK. That means whenever they want to appear in the training, so if they got MRCPCH, full MRCPCH, they got preference. And there are several steps like ST1, ST2, ST3, ST4, their career progression. And whenever anyone is on the ST3, it is expected that they completed theory exam. Although MRCPCH exam is also the only exam in the Malaysia that is accepted in their career progression other than their board exam if it is exist, as well as this exam is accepted in Singapore. So it is the only exam for their career progression. In the Middle East, all the Middle East countries, Saudi Arabia, Dubai, Oman, this exam is highly valuable exam, and also this exam ensure they are, if they pass this exam, then they got some benefit in their working life. So how this exam, how can we appear this exam, and how can we overcome this exam? So that is very, very important things that we should know. If you are interested for this exam, then you should know that they have a good website, that is the Royal College of Pediatrics and Childhood that I mentioned here. So this website is very, very rich website. Okay, so this rich website can help you to get out how the exam is. Everything is mentioned there, and they also time to time change their way of exam, their assessment criteria, their questioning style, and they always mention it in their website. So let us discuss about how the exam is. So exam is divided into 4 ways: foundation of practice, theory and science, applied knowledge in practice, and MRCPCH clinical exam. So this exam is mainly, you can say, is theory part and the clinical exam. So theory part, you can say it is 1, foundation of practice, and then theory and science, applied knowledge of practice. These 3 exams can be given divided way, like first FOP, then TAS, and then AKP, or you can give first AKP, then FOP and TAS. But FOP and TAS also can be given on the same day. Okay, so these are FOP and TAS you can give on the same day. So then the clinical exam, but we have to very much I be confirmed about it that you cannot proceed the clinical exam without completion of theory exam. Okay, so you have to must pass this theory exam, that is FOP, TAS, and also the applied knowledge of practice. Okay, these exam, 3 exams have to be passed, then you can appear in the clinical exam. So one of the very important questions frequently I see many of our colleagues ask it, that is this exam required English fluency test or any training certificate? Is there any training required? So you should know that there is, there is no requirement of English language test other than you seek for GMC, General Medical Council. It is like licensing. For example, in Bangladesh, there is BMDC. So I know there is different body. In every country, there is a body who give license. GMC is a license for the UK for working criteria. Okay, so for that reason, English test is required. But other than this, English test is not required. So you require minimum English level? Yes, because the exam is English. So you require a minimum English level so that you can understand the question, answer, the books, and all the medical students, those who pass, they have minimum English level. So nothing to be worried with the English language test. Another is, any training certificate required? No, absolutely not. No training certificate is required. So is there any training required? So I should say that in the website, they mention for the first part of the exam that if you consider this first part like FOP and TAS, so these 2 exams, they say that 6 months training is advisable. That means 6 months training can help you to pass this exam, but it is not a must criteria. For the AKP exam, they say 2 years training should be, but again, it is not the must criteria. So a very important thing is you can proceed without training, but you know that I know many of even my students, those who passed, they passed this exam without any formal training. Okay, without any formal training. But again, if you do training pediatrics, it's really helped you to understand the scenario, understand the question and answer. But they will never ask you, give me your training certificate, even not the clinical exam. So how the exam would be? So now they are taking exam by 2 ways. One is center-based, that is test center. Another is online-based, 2 system, okay? So 2 system, online system and the test center. So test center means, you know, they will give you all the requirement that is required to give the exam for stable internet connection, laptop, everything. But in the online system, you should have something like stable network system, as well as computer, smartphone. These are the things. So very important, stable network. But nowadays, the only requirement is stable network as well as 1 laptop. So nothing more than this. You can give this exam by this way. But if you are in a in your center, or if you are in the locality where you can easily give the test center and you wish give this exam on online base, they will not accept. So they will ask you to give your residency proof. That means where you are situated, and then they will accept you that you are giving online or test, because there is a huge demand on the online system. One of the frequently asked question is online system exam is safe? Yes, it is safe, but you should have minimum understanding of use of like a laptop and some basic knowledge you should have. Uh, and sometimes if you have not stable network, it can be disturbing. But many of our colleagues gave this exam through online system and they succeed. So any test center in the Bangladesh? No, it's not now available, but there is a lot of test center in the India, Pakistan, Saudi Arabia, Middle East, many countries. So there is nothing to be worried. And sometimes if anyone having like for religious purpose, they want that only female invigilator should be in the online system exams way, so they can take the only the female invigilators. That means when you are giving exam through online, someone is observing you, someone is taking care what you are doing. You can't do anything. Like if whenever you open that laptop and start exam, you cannot even do the Google. They can capture. So there is a lot of improvement in the system. So it's a very fair exam through the online also. So very important things, you should have your exam account. So it is your first task should be like whenever you think that you are going to give this exam, because there is some rules. I'm repeating, there is some rules. So which is the rules? So that means whenever you want to book this exam, so that times you should have your exam account. Otherwise, you can't book this exam. Even 2 weeks before the booking time, you should have your MRCPCH account, that is RCPCH account, before 2 weeks of your exam account. Those who are going to join the next course that will be start from 1st May, please get ready for the exam account. And there is it's not very much difficult now. Any of website, if you want to exam account, you have to click on the first you are register of the system. You want to do the registration, and then they will ask you a few questions related to your personal things as well as your career, and then they will ask you primary medical qualification, that is the MBBS certificate, and then you can get your exam account. And then they will give you a number through email. Whenever you get the number through the email, you understand this is my GMC number, RCPCH number, and then it will be activated. So it takes time to understand, to open the account and do the things. At least 2 weeks to 4 weeks is usually required. So get ready to get the exam account if you want to give this exam. Very, very important. So when the exam booking system will be open and when it is a date, I'm sorry, it goes away again. So application period is, it is now, next exam date is 24th June, and the exam booking was open 7th April. So you see that it is 2 months before the exam. It's not only 2 months, it's now 2.5 months before the exam date. The application open, okay? So the application open. That means booking time was 7th April. So now if you want to give the exam at June, you can't. Those who book the exam only, they can give this exam. And it was the date how the everything will be in the RCPCH account. They update when the booking time and booking close. There is different times. Even you see that they always give the UK time. These are the place where the exam can be conducted, theory exam. You see that now they open in Trinidad and Tobago. Even you see Qatar. Qatar was a new center. Bahrain, so Jordan, Kuwait, India, Pakistan, Sri Lanka, Malaysia, Singapore. These are the center. Okay, so you see these are the center. So every year, approximately 3,200 candidates attempt the FOP, FOP and TAS exam. 2,000 attempts in the AKP and 1,700 attempt the MRCPCH clinical exam. A huge exam candidates is there. So there were some changes from 2021 in their booking system. So you should know of this, that those who having no test center only, they can give the online system. They have to be reside 200 miles from the test center, and so some adjustment can be taken if they have some health issue. So they cannot move to go to give the exam other place, so they can make some changes. So they can directly mail to the RCPCH. So then another thing was the time of attempt, how much you can give the exam, how many times, that is also changes. So, and only 6 times can be given this exam. Okay, 6 times attempt can be taken. And as well as theory exam, after you complete the theory exam, that means FOP, TAS and the clinic AKP exam, after you complete this exam, you have to appear the clinical exam within 7 years. If you don't appear the clinical exam within 7 years, then they will give a mail, although that your exam time is going to be end. So then you have to appear. If you cannot pass this exam within this time frame, then you have to again start with the theory exam. Very unfortunately, but they really very kind. If you give a mail and give some personal consequence or anything, they can increase this timing as well. So really they are reasonable, but they are very much strict on the rules. So, but you have to prove that you have some personal consequence so that you cannot appear within the time. So remember, 6 times and within 7 years. And now they again just started new things. That is, you should have passport which having 12 months validity. Whenever you want to appear in the exam, that time. For the exam booking, you should have credit card or MasterCard. So mainly credit card. Okay. So for credit card, you should have a bank account as well as passport. So exam fee is varies from country to country. It depends on the dollar conversion rate. But if you take the like pound, then FOP is 455 pound. TAS is 455. But if you give the exam both in one day, then it is 775. Near about in Bangladesh taka, it is 1 lakh. For the both FOP and TAS, applied knowledge in practice, it's 895 pounds. It will exceed 1 lakh usually. So the timing in the exam, you see, it started 9:30, 5-hour difference from the Bangladesh time. So and 9:30 to 12:30, so 3 hours. Yeah, and then theory and science will be start later after FOP TAS. In between time, they will give 2 hours gap. So it is the exact timing for this exam. So you should have on or NID is required, or driving license, or passport, mainly passport. It is now not 6 months, it is 12 months should be validity. So how you prepare for this exam? Is it difficult exam or is it easy exam? So nothing is like this. We cannot say that is it difficult exam or it is easy exam, because you know that the things is how much you prepare for the exam. That is important. Then you can I can say that it is, I mean, I prepared, but I cannot pass, so it is difficult or something. But really, it is achievable exam because they are very much structured, very much structured. Okay, first of all, if you just check that this is the clinical case book for FOP, this is pediatric guideline, this is some topics from the neonatal guideline, recall files is required, sample paper is required, past test is required, and also illustrated test book of pediatrics books sometimes required, but not always. So the FOP books is for the FOP exam. There is a case book. It is like yellow colored. It's called case book, and case book is a combination of several, number 1 case, number 2 case, like this, and these books discussed all the things. I think one pictures is there. Let me show you. It is very important books in the RCPCH. No, I did not attach any pictures here. Okay. So, so this book is discussed one case and some differential diagnosis, how they reach the diagnosis and what's the investigation, management planning. That is the clinical case book. 50 case was discussed for the FOP exam. It is according to the exam way, and RCPCH, it is only written for the exam, and it's all the consultant of the NHS, they wrote these books for the RCPCH exam way. And also the pediatric guideline, which is very important guideline. It is always they give this, update these books every 2 yearly usually. It's now they are one book expired, they are update timing. So and then pediatric guideline is actually, it's a guideline for all the exam, for the FOP exam test. It is for the clinical exam, it's an AKP exam, even if you are working in the NHS or other places. So it can be a great guide. And some topics from the neonatal guideline as well. Recall file is most important. Those who are hearing my my voice, please remember, without recall you can't give this exam. And sample paper in the RCPCH available. Past test, previously always everyone said that past test have to read, and past test subscription need 300 USD, but it's not that much. I mean, it's not that much required. It can be nice to know. I should say that its PDF is available, downloaded PDF is available for the past test. You can see this. It's more important those who are not that much clinical experience, that they can go through these things. But mostly you have to know the recall files. But every year recall is available. Every year there is how the exam answer would be, that is also available. That's very important. But you should have clear concept on the topics. So it is very important. You should have a clear concept of on the questioning style. Even if you can be a very good clinician, you can be you have many knowledge, but if you don't know how the question is, you can't pass this exam. Really, I'm so sorry to say. So you have to know the questioning style, and you have to compare that these questions came this way, this question came this way. And very important things is ethics, which is not practiced in every country. So ethical guideline and ethics, palliative care is special topics that is came in the exam. Ethics, palliative care, you should know. So TAS exam is similar like FOP exam, but they are like, you should have the diagnosis, you should have the clinical scenario. Like from a clinical scenario, one diagnosis it's mainly FOP, but on which theoretical basis you do it, this is for the TAS exam. So some theory knowledge is required. But investigation treatment related question is common for both FOP and TAS. So FOP and TAS separately, it's not should be, read out. It should be first, you should read for the both exam, then you can give this exam separately, you know. You can give this exam separately, but it's like you should have preparation first for the both exam. Then if you have any options like exam giving in one way, like for the 3 hours, it's not easy. Okay, so 6 hours for the exam, and it's very stressful. So you can give this exam separately, no matter. But you should prepare for the both exam as a whole, not separately, really. And also, here important things is statistics. Some questions are related to the statistics that you have to read. And also jury notes means recall files for pharmacology is also very important. Pharmacology question is very important. So now the questioning pattern is now only the single best answer type, like you have to here you have to only it's in, sorry, the question is just a minute. Okay. So is it showing? I think no. Again, I'm sharing. So here you see that best of 5 and extended matching questions. These all are the previously the exam is like this way. So extended matching question is now no more. It's only a single best answer. Okay, so you have to choose one answer from the probable answer. Okay, this is the way. Now the question is total 100 question. You have to give the exam within 2 hours. You have to give this exam within 2 hours. The total question is 100 and it will be 2 hours within this time frame. Then, you know, there is some link here how this exam will be conducted. It is here you get the sample paper link, task sample paper link, answers also there. Even you can give a dummy exam on the RCPCH. So there is a lot of helpful link there. So what's the preparation time? It depends actually background. I see many of our colleagues just join and within 3 months they give the exam and they passed out. But some takes even 12 months. But some average day, I should say, it is 6 months. So it depends on your background knowledge. If you already experience in pediatrics, you have a lot of knowledge. And in that time, maybe you require less time. And if you can give a lot of time, so every 6 hours, if you can read, then 3 months you can be. But if you give this exam with easy, then usually 6 months required. So what can be beneficial for you? So one of the important things that you can get your GMC account, GMC license, and you can take a job in the UK. One of the benefit you can get through the MTI route, fellowship in the UK, and then you can come back to your own country. So you can get training in the NHS and then come back to the your own country. So it's one kind of training with like you can get salary benefit as like UK those who are working there. So MTI fellowship it's called, and also you can work Middle East countries, Malaysia, Singapore. So there is a lot of opportunities. But you know, it's even if you think that I will not go abroad, I will work in my own country. Really, this exam will help you a lot for managing patient, for I mean, your colleagues' attitude, your behavior even, because this exam is really game-changing exam, I should say. It's really change your way of approaching to your patient, way of approaching your colleagues. If you are a good person, then you will be more good persons, I strongly believe. But if you are a bad person, the exam will not make you a very good person. But I mean, your approach to a patients will definitely change. Really, any kinds of MRCP, MRCS, MRCPCH, MRCOG, all the exam format is such a way they will make you change in your managing patients, and really you will be benefited for managing. But yes, if you ask me that is it accepted in the Bangladesh or something, no, it's not accepted without training. But you can get DCH and equivalent respect, okay? But there is some new rules, in Bangladesh. You can, if you completed MRCPCH, then you can easily exempted from the FCPS Part 1. So here we are going to start a new batch for MRCPCH, a new batch, and it will start from 1st May. And here it will be live and followed by recorded, and this recording will be persist up to 2 weeks, usually Zoom link, and every week 1 or 2 class will be, but it will be on the topic wise. So for example, you will get I think I add here 1 topic wise. No, okay, so I'll show you how the topic is. For example, cardiology, 1 day cardiology, so it can require 2 class or 3 class. So I will do everything related to the cardiology, followed by there will be 1 exam, and also there would be recall discussion separately. So the cardiology, which questions came before in the exam so far, that will be discussed and followed by 1 exam we get. So by this way, every topic will be solved, and it is like I will give PDF file for that reason. So like it is dermatology. So here I discuss some topics, and it's like based on the case book, guideline, and the reference book and the recall based. This PDF was made. So it is a topic wise PDF followed by we will then recall discussion. So it's all the recall will be discussed there, especially in the live class 2 years recall will be discussed, and then we'll discuss the so these are the question answer. I'm opening a website soon, probably in the middle of the May. So that time in the website, those who subscribe this website, they can take only the recorded options only. I mean, though they can take their preparation by their own, even by just subscribe the website, and through the website they can see all the classes, PDFs, and other things. So it's a completely preparation way. So you can, if you are already in my groups, I have YouTube channel. There you can see how the class was conducted, as well as I have a Facebook page group, and if you already with these groups, you can know that the success rate of those who took the exam full course 100%, and sometimes it is in 98 or 99, it's mostly 99. So very high success rate, I can say. Alhamdulillah. I am not I mean, look on the number of the how much the students will join. I'm just looking on the quality. Always try to ensure that it's high quality can be maintained, and so that everyone can get benefited. Our WhatsApp group will be made. Those who subscribe the register for the May course, which will be start, and then they will add it in the WhatsApp group, and there I will upload everything. So by this way, I will conduct. But if you have anything wants to know, you can ask me related to that. You can, I mean, even you can take your own preparation if money constraint. Really, you can take your preparation by your own. You must have too much dedication, and you have to give too much time as well. Like you have to go through all the books and recalls, and you have to make your own mind how the exam will be like this, and need to discuss with some like some partners or friends, colleagues. Also, you can do by this way. Many of our colleagues also did this way. But if you require any extra help, or by any way you want to take help, so I'm ready to help by my course by this way. But even if you have any questions other than this, you can ask me. And also you can WhatsApp me anytime. So please let me know if you have any query so far. If it is not query, so we can take leave. So good night, everyone. Hope all of you will succeed in pursuing MRCPCH exam. Best of luck. Thank you.